missing glucocorticoids and mineralocorticoids.
Right, the cortisol and aldosterone.
Exactly. For glucocorticoids, hydrocortisone is typically the preferred choice. It's usually prescribed in divided doses, often mimicking the body's natural circadian rhythm, so maybe 10 to 20 milligrams in the morning, and 5 to 10 milligrams in the late afternoon or evening.
To mimic the natural pattern.
Precisely. Prednisone is another option. It's longer acting, taken once daily. But crucially, patients need to learn the sick day rules.
Ah, yes, the sick day rules. Tell us about those.
This is vital. During times of illness, like a fever, infection, or significant physical stress like surgery, or even major emotional stress, the body naturally needs more cortisol. So patients must learn to double or even triple their usual glucocorticoid dose during these times to prevent an adrenal crisis.
That sounds like a big responsibility.
It is. We also have to caution against overtreatment, though. Taking too much glucocorticoid long-term carries its own risks, like osteoporosis, weight gain, and increasing the risk of diabetes. It's a balancing act.
Right. And what about the mineralocorticoid, the aldosterone replacement?
For that, we use a medication called fludrocortisone, usually taken once daily. The dose, typically between 0.05 and 0.2 milligrams, needs to be carefully adjusted based on the person's blood pressure, their electrolyte levels, specifically sodium and potassium, and sometimes their plasma renin activity levels.
The monitoring is key there, too.
Constant monitoring, yes. And sometimes patients might also need to maintain a relatively high sodium diet to help manage their blood pressure and sodium levels.
Okay. And for women, you mentioned androgen deficiency earlier. Is there an option for androgen replacement, like with DHEA?
Yes. For women experiencing symptoms like low libido, fatigue, or reduced mood that aren't fully corrected by the other replacements, DHEA replacement, usually 25 to 50 milligrams per day, can be considered.
What's the goal there?
The goal with DHEA is really to try and improve those specific symptoms. Libido, mood, overall energy levels, addressing those particular aspects of hormone deficiency that can impact quality of life.
Now, you mentioned the adrenal crisis earlier as a life-threatening emergency. Let's just reiterate the paramount importance of managing that crisis. What are the immediate steps if someone presents in crisis?
Paramount is the right word. It is a true medical emergency requiring immediate action. The first steps involve administering intravenous, or 5E, hydrocortisone, usually a large initial dose, like 100 milligrams, followed by regular doses, maybe 50, 100 milligrams every 6 to 8 hours.
Straight into the vein, high dose.
Absolutely. 5E fluids are also critical, usually 0.9% saline or normal saline, given rapidly to combat dehydration and low blood pressure. If blood sugar is low, dextrose might be added to the fluids.
Right, fluids and sugar.
Correcting those electrolyte abnormalities, the low sodium, the high potassium, is vital. And simultaneously, you need to identify and start treating whatever the underlying precipitating cause is, like an infection, to actually stop the crisis.